Hello, Dr. Gordon and fellow colleagues. I would like to present to you my sales presentation on a chemical dependency program curated for healthcare professionals that struggle with substance abuse while working in a hospital setting. This presentation will cover 3 different ways of presenting the program to a prospect. Allow me to introduce to you the prospect this presentation is directed towards. The prospect is an employee assistance professional, or EAP for short, of a large multi-specialty hospital located in a metropolitan area. Employee assistance professionals are responsible for the employees of a company and provide counseling or support for any circumstance that might interfere or affect their performance while on the job. For the sake of this presentation, we will assume that the hospital the EAP is employed by does not currently have their own chemical dependency program and that they have recently had issues with employed healthcare professionals struggling with substance abuse. The first sales method that we will observe is called the stimulus response approach. This approach can be considered as a cookie-cutter way of sales presentation. It is based on the experiments of psychologist Ivan Pavlov, where a dog was trained to respond to a substitute stimulus, a bell, in place of the actual stimulus, food. Just as the dog was led to react in a certain way, the EAP is led to respond in a favorable direction by the presenter. Let us now look at how a sales presentation might look like using the stimulus response approach. In a stimulus response approach, the presenter would incorporate scripted questions that would encourage the EAP to arrive at the conclusion that investing in the program is beneficial for the hospital. The presentation would start with a brief introduction to the program and some important statistics about clinical staff's substance abuse issues. The chemical dependency program is specifically for healthcare professionals working in a hospital setting due to the special circumstances surrounding their occupation. The program is customizable, allowing flexibility based on the participant's schedule, while still making sure their treatment follows state guidelines. The program itself is supportive and challenges the participant to be proactive in their recovery, but does not force a participant to admit to something they do not feel. The program also incorporates occasional check-ins with the participant to keep them accountable and to make sure that they are adhering to the treatments. Lastly, the program not only helps with the recovery process, but ensures that the work environment is safe for both the provider and the patients by making sure the participants continue with their sobriety. Here are some of the examples of the questions the presenter would ask the EAP throughout the presentation. Most of these questions require only a yes or no answer from the EAP, such as, did you know that healthcare professionals working in a hospital setting are at the same, sometimes even higher, risk of substance abuse than the general population? Would you agree that the healthcare professionals working in a hospital setting have easier access to narcotics? Would you feel safe receiving consultation or treatment from a possibly intoxicated physician or nurse? As an employee assistance professional, would you agree that a chemical dependency program would benefit the participants and decrease interference with their work and personal lives? Don't you think we should invest in our healthcare takers so that in turn the quality of care the patients receive is guaranteed? These questions are aimed towards making the EAP feel like the hospital needs the chemical dependency program to ensure staff and patient safety. The second approach we will observe is called the selling formula approach. Unlike the stimulus response approach, this method allows the EAP to be more active and gives an increased range of flexibility to the presenter. The presenter needs to engage the EAP in order to figure out how the program might be a useful tool at their hospital. Let us observe this in action. The program is introduced to the EAP in a similar way to the stimulus response approach. The difference with the selling formula approach is how actively the EAP will be participating during the presentation. The presenter creates moments using open-ended questions where the EAP can express their interests and concerns. The selling formula approach consists of 4 steps the presenter will walk the EAP through, with the last step being the purchase of the program. The first 2 steps are getting the attention of the EAP and feeding their interest in the program. The presenter could use statistics gathered by various studies to bring to attention the seriousness of the problem. For example, according to a study done by Mumba, Baxley, Snow, and Cipher, in the general population, roughly 24.6 million Americans use illegal substances every year. Nationally, it's reported that 8% of nurses struggle with substance abuse, and the risk factors include easy access to drugs, work-related stress, and lack of education about substance abuse. Ross, Jackie Berry, and Simi explained in their study that based on a systematic review, a regimen derived from the Physician Health Program for nurses was unsupported by scientific evidence and had poor methods. There is also a large gap between relapse rates of nurses and physicians. For nurses, the relapse rate is 40% compared to that of physicians, which is 20%. This is because nurses are provided with different chemical dependency programs than that of physicians. While physicians take part of a comprehensive detox program that comes with therapy and behavioral interventions, nurses are only provided with monitoring programs and need to pursue treatment themselves if they wish for alternative programs. By using a chemical dependency program that incorporates all types of recovery treatments and make it available for all healthcare professionals within the hospital, the rate of relapse will be smaller and thus less healthcare professionals needing further disciplinary action. Because the main difference between the stimulus response approach and the selling formula approach is the participation of the EAP during the presentation, here are some examples of open-ended questions that would be incorporated into a presentation using the selling formula. The presenter would ask questions such as, what are your thoughts on the current issue with the substance abuse, especially with healthcare professionals? Do you think your hospital is lacking in a specific area in terms of finding support for those struggling with substance abuse? Would you agree that there is a gap between available treatments for nurses and physicians? The third and last method we will observe is called the need satisfaction method. Now this method, compared to the previous two, is more customer-oriented and without being too personal, offers a solution to a problem the EAP might currently be facing. Using real-time statistics and facts, the presenter will be more direct and converse with the EAP to figure out what the problem is, to make sure that the EAP is on the same level in understanding, and offer the solution to this problem they have uncovered. Unlike the other two approaches, for the need satisfaction method, we will not be starting with the introduction of the program, but rather start with figuring out what the specific needs of the hospital are. To start off the presentation using the need satisfaction method, the presenter would ask questions to the EAP to see what specific needs the hospital needs to fulfill. These questions would lead to discovering places where the hospital could improve, getting the EAP to be on the same level of awareness, and then offering the program as a solution to these issues. Questions that the presenter would ask are, how many healthcare professionals are currently employed by the hospital? Of the employed, what percentage have required disciplinary action? Of that percentage, how many required disciplinary action due to using illegal substances? What are the relapse rates of those who participated in some form of recovery program? What do the employees think about the current options given by the hospital? For the sake of this presentation, we will use this table from a study done by Mumba, Baxley, Snow, and Cipher as the statistics of the hospital the EAP is employed by. In addition, statistics of the overall healthcare professional population from various studies will be used as a hospital statistics as well. Table 1 shows us a list of reasons why healthcare professionals were referred to peer assistance programs, with multiple categories pertaining to illegal substance use. Not only that, nurses have a relapse rate of 40%, physicians have a relapse rate of 20%, and only 40% of the participants were able to complete the program. And from recent studies done on the current form of chemical dependency program, the regimen used for nurses and physicians aren't supported by scientific evidence. At this point in the presentation, the need has been established to the collection of statistics and evaluation of the current situation. Now with the needs established and the EAP on the same page as the presenter, the program can be introduced as a solution to the hospital's problem. Each part of this chemical dependency program being presented targets an issue that the hospital is seeing with the current program they are outsourcing. To wrap up the presentation, I would like to read a passage from Jeremiah chapter 17, verses 9 through 10. The passage reads, "The heart is deceitful above all things and desperately sick. Who can understand it? I, the Lord, search the heart and test the mind, to give every man according to his ways, according to the fruit of his deeds." We need to be reminded that God does not look at our credentials or the amount of money we have or how much power we have in society. He knows us by our heart's intentions and the fruits of our efforts. As Christian healthcare professionals, marketers, and providers alike, we should be more mindful to the people we are serving during the length of our careers. No matter what approach we use or the programs that we promote, our intention should be solely for the better of society. Using Jesus as our ultimate sample of kindness and mercy, we need to work together to keep each other accountable and away from deceitful intentions. Thank you so much for your time and for staying until the end of this presentation. I hope that each one of us can apply the things we have learned during this presentation in our current careers or in our future endeavors. Once again, thank you and God bless.